Oh, okay. Hello, everyone who has joined us in this webinar from the education program of the International Society for Telemedicine in Health. I'm Jefferson Fernandes, director of the education program, and we are starting now our webinar about digital health education, why and what healthcare professionals need to know. Together with me are two experts in education field, Dr. Micaela Monteiro, who is the Chief Medical Officer for Digital Transformation of CUF Saúde, and Dr. Helena Canhão. She is the Dean of the Nova Medical School from Universidade Nova de Lisboa. So it's my pleasure to have them together with me today for this for the presentations that we're going to have, and in the end of our three presentations, we're going to open for question and answers. So please, if you have a comment to do, a question to ask, do it in the Q&A button or in the chat button, preferably in the Q&A, and we will start the conversation with you after the three presentations. So the education program is an initiative of the International Society to stimulate and to foster the education in digital health, telemedicine, telehealth, and all other topics that are of interest. So we're going to start now with Dr. Micaela. Please, Dr. Micaela, you should bring more information about your background, your activities for our attendees to know. Micaela, the screen is yours.
Thank you very much. So yes, thank you very much, Jefferson, for having me here, and Helena, hi. Yes, it's a great pleasure. As you said, I'm the Chief Medical Officer for Digital Transformation at CUF. CUF is the largest private healthcare provider in Portugal, with we serve over 1 million patients. I'm a physician. I'm an internal medicine specialist, and I had, as my former role, I had the pleasure to be the head of the National Center for Telehealth at the Shared Services for the Portuguese Ministry of Health. So there is quite a track in digital health and telehealth, and yes, I'm an enthusiast and in this field.
Okay, please, you can start your presentation.
Yeah,
if you want to share us your screen. Yeah.
Right. Yes, I want to try to share my screen. If you could give me some feedback. Can you see the screen?
Yeah, that's wonderful.
Okay, great. So yes, today I would like to share 3 reasons why health professionals really must know and understand digital health. Oops, let me see. Sorry. Yes, just a disclosure. I'm also a coordinator of a course in digital health, which will be held in October in Lisbon. And yes, let's start. So, relax, buddy. They invented the vacuum cleaner, yet I'm still here. Well, as healthcare professionals, we may choose the posture of this broom, or we can rather look around and analyze what is already happening in the world when it comes to health, what are the challenges now and in the future, and what is our role as healthcare professionals in all this. So I prefer this approach, and so let's try not to put our heads into the sand, and let's look around. The world is rapidly changing, and so is health, and it starts with the people we care for. The patients are changing. And this here is a testimonial by a clinician who responded to the Clinician of the Future survey. It's a survey provided by ISfTeH for its Clinician of the Future report 2022. And this colleague says, patients are increasingly using me to get to an end and demanding care the way they want it, instead of listening to all options and making informed choices. The opinions of family members, online chat, and Google searches are deemed more important and informative than my trained opinion. Well, I must say, I very often recognize myself here in this sentence, and I'm sure that this is also true for many here in this audience. So last Friday, for instance, in my outpatient consultation, I saw a young lady who had dysuria. She told me that she had a urinary infection. She had spoken to a friend and had Googled her symptoms and needed me to prescribe an antibiotic. Well, the next patient was an 88-year-old lady with chronic heart failure who was being quite well controlled, but she came because she felt exhausted, without energy, and was still afraid to meet her friends or to go to a shopping mall because of the pandemic, and asked me for advice. And then, in the end of the consultation, there was this middle-aged couple who sat in front of me and told me they would like to do their annual checkup and showed me the list of exams they wanted me to prescribe. So these patients fit perfectly into this patient preference framework that you can also find in the Clinician of the Future report. Patients today, actually, they are different. They have access to a lot of information and know what they want from their healthcare provider. And on the other hand, we as healthcare providers struggle to acknowledge and digest all the information at a time where medical knowledge doubles every 73 days. So, but it's not only patients that are changing. Healthcare itself is also changing. It is becoming increasingly remote, data-driven, even automated, personalized, and preventive. We all witnessed a huge rise in teleconsultations during the last years. Technology is increasingly used in the management of patients with chronic disease. And then there is even teletherapy, such as in this example, telerehabilitation. And patients receive their prescription on their phones. Patients increasingly use messaging services to contact us. But when we look at physician and patient's perspective on telehealth, we see a gap. So here you can see a study done by McKinsey, a survey, and you see that patients really, like the convenience. They choose telehealth because it is convenient. They like the experience. Sometimes, or even often, they are even more satisfied than with in-person care. They want to continue the usage after the pandemic, and they are even interested in more offerings, in a wider offering in digital health. Physicians, on the other hand, are much more conservative. You can see this on the bottom line. They are much more conservative regarding their evaluation of telehealth. They have lower expectations and are less willing to integrate telehealth in their daily practice. These physicians here in the survey, they might think, as the broom in the cartoon, relax. Patients will still do what doctors tell them to do. But watch out. Big consumer companies are entering the telehealth, the healthcare market. They have a lot of experience to design services according to consumers' preferences. They know how to deliver convenience and seamless customer experience, and they are fast. Amazon Care started in September 2019, first only for their employees in Seattle, and it's now already available to patients all over the US. And we know Amazon, it's a question of time, and we will see their services in other parts of the world. But there are also new digital native healthcare providers, like this one. Probably many of you have already read about them, heard about them, Babylon Health. Babylon Health started in 2013, so less than 10 years ago, with digital first primary care in the UK, and is now in 16 countries, serving, as they say, 24 million people. And they went public at the New York Stock Exchange last October. So care is also becoming increasingly global. So a healthcare provider in 16 countries. Yes, healthcare is changing and it's becoming increasingly data-driven. So I think we all agree that health data are simply overwhelming. It is estimated that in 2020, 2,314 exabytes, and 1 exabyte is 1 billion gigabytes of health data were produced. And probably many of you also know Eric Topol, who is a physician, and he is the chief editor of Medscape, and he is an advisor to different governments, for instance, also for the UK's NHS. And he wrote in one of his books this sentence: with the challenge of massive and ever-increasing data and information for each individual, no less the corpus of medical publications, it is essential that we upgrade diagnosis from an art to a digital data-driven science. So, and automation is not only about self-driving cars, it's happening in health as well. You see here the image of an AI symptom checker. It automates the first bit of medical consultation, history taking, and the estimation of diagnostic hypotheses. And look, according to this study, published in the BMJ, its accuracy comes very close to that of doctors. And when it comes to pattern recognition of images, we even witness how deep learning outperforms humans, like for instance, in this example from dermatology. So we now have software that mimics medical reasoning. And this is one of the reasons why the European regulator has issued the new medical device regulation in May last year. So software, look just at this, the left top of this chart, and you will see class 3. And here software even intervenes in the treatment of diagnosis of critical patient conditions. So this is really, yes, an evolution that is really astonishing. And this gentleman here, this is Jens Baas. He is a surgeon by education, but he is also the CEO of the largest healthcare insurance in Germany. And he said this: we will find that it will be malpractice to make a diagnosis without also consulting an artificial intelligence. And it is, of course, all this big data and its analysis that will enable precision medicine. For instance, in the field of oncology, where treatment will be increasingly tailored to the individual profile of every patient in order to yield the best results with a few secondary effects. We will be able to anticipate adverse events and prevent them, as in this example, where patient in bed 4 is likely to need respiratory intervention in the next 8 hours. So, but you may ask, well, do we really want all this? Do we need all this? Empowered self-service, patients, automation, and so on and so on. Well, then let's look into our not so far future. Please look here at this chart and where our societies are heading to. This is the demographic evolution that we are expecting. And aging is a global phenomenon. So what do you think will soon be the ratio of people who need care and those who are able to provide care? So, and age comes, of course, with disease, with chronic disease, as you can see in this chart. Chronic disease is disease which needs a preventive approach and continuous integrated care. And it will require human resources that simply won't be available unless we change the way we provide care. So, healthcare is already struggling with financial sustainability issues. The percentage of the GDP societies are spending on health is continuously rising. And this is in fact unsustainable. And this is what Ali Parsa, who is the CEO of Babylon Health, I talked about it in this company before, says. There is no accessibility without affordability. When you look at the costs in healthcare, they fundamentally sit in two buckets. They sit in salaries. Doctors, nurses, healthcare professionals in different parts of the world take between 50 to 70% of healthcare costs, and they sit in timing. Predictable, preventable diseases are responsible for 70% of our costs. So I think we can all agree on that. Healthcare professionals have an important role and responsibility in this change. And digital health can also widen gaps. It can enforce barriers to access and equity. And we as healthcare professionals must create health journeys that are meaningful and don't leave people behind. So did you know, for example, that in Europe, only 38% of those aged 55 to 74 and 32% of the retired and the inactive possess basic skills in this domain? So this is a barrier to healthcare, and it is a barrier to digital healthcare. So let's not forget that technology is a tool. We must ensure that it is clinically effective and safe. What are the technologies in digital health ready to be adopted? Which should become standard of care, and which have no evidence that supports its usage? These are issues that are up to us, healthcare providers, healthcare professionals, to decide. And we have a commitment with our patients not to harm them. In this example, algorithms made physicians withhold needed pain therapy, for instance. And listen again to Jens Paas. He says, it would be immoral not to use artificial intelligence in the health sector, but it needs the right moral to set boundaries for machine use. So here are 3 reasons why we must know and understand digital health. Healthcare is rapidly changing. Patients' needs, providers' role, available knowledge, technology, the market, all this is changing. Second, digital health is a big opportunity to address the challenges in health: aging, human resource scarcity, access barriers, and sustainability. But digital health has also risks and pitfalls. Deep understanding of medicine and healthcare are required to create the meaningful and safe healthcare of the future that we certainly want. So we are all called to be architects of our future, not its victims. And yes, thank you for your attention. And yes, looking forward to your comments and also to what my fellow speakers are going to share with us. Thank you very much.
Thank you very much, Micaela, for your insightful and timely presentations on why health professionals should know and understand digital health. I think you presented us the view of not only of today, but the near future that compels all professionals to learn more on this subject, to train more, to have more education, and why not digital literacy? You touched on a point that I think it's very important. Of course, we are focused on health professionals, but the citizens also need to be able to reach opportunities of digital education for their own benefits. So it's something that should be spread not only the health professionals, but to the population itself. Thank you very much, Micaela. So just for those who are coming now to our webinar, welcome. And we are doing now the presentations, and after the presentations, we're gonna have the Q&A session. So I stimulate you to pose your questions, your comments in the Q&A or in the chat button in your screen. Now, our next speaker is Dr. Helena Canhão. She's the Dean of the Nova Medical School from the Universidade Nova de Lisboa. And it's a great pleasure to have you among us. Helena, please introduce yourself with more information, and you can immediately start also your presentation.
Thank you so much, Jefferson. I'm Micaela. Nice to meet you, and thank you for everybody that are listening to us. It's a pleasure to be here in this meeting of the International Society for Telehealth and e-health. I'm rheumatologist by training, and I'm now the Dean of Nova Medical School. And I'm very interested in this field for the educational part, because we have a pre-graduate and postgraduate school of medicine and nutrition, but also from the part of as a physician and also as a researcher. In our group, we are doing some research regarding aging people and new technologies, and this is a challenging world to research. So it's nice to be here and discuss these topics with you. I will start by sharing my slides. I will talk a little bit about the why, what, and how to develop digital health education with some considerations, but I think most important is the discussion in the end with the audience and with Jefferson and Micaela. Digital health is transforming the access and delivery of healthcare, and Micaela already talked about this. There are huge opportunities like these new technologies, telemedicine, smartphone apps, wearables, that will be integrated in healthcare delivery with significant benefits. But on the other hand, we have risks. Like the increasing of health inequities because of the access to these new digital health means. Also problems or challenge with data protection and some accuracy limitations on the diagnosis or on the decision to treat. We know that now there are every day millions of different data points that are captured about the individual's health, like the calories that we are burned during exercise, or the time spent watching TV, or the tests taken at the doctor's office. And these are only some examples. And we know that in other fields, these digital technologies and the information that is captured are transforming the way we buy and we listen to music, the plans for travel. We are always receiving new information about travels, about hotels, and lots of different things. And maybe healthcare can be the next field that is transformed because of the data that are captured. And sometimes we don't even know that it's captured for someone. From someone. The digital health education is really, really important because we need to develop knowledge in this field, skills, and also attitudes. And attitudes, knowing the barriers, knowing the perception, the expectations are really, really important when we are talking about digital health and the proper education. And I think it's really very important thinking strategically thinking, because we know, and Micaela also talked about this, the future of healthcare is digital, and with digital technologies we can improve healthcare, but it's necessary to think of the way of adopting and implementing this digital transformation in organizations. And I have here some examples just to think on that. understand how digital technologies can address critical points in healthcare, but also learn how to think about the applications of collecting and using data to inform healthcare, but also the privacy risks and the pitfalls in the analysis of healthcare data. Also, to explore the opportunities and difficulties of enabling digital approaches, and navigate the systemic barriers and the conflicting needs of the different stakeholders when we are bringing technologies to market. So these are different challenges, but at the same time, different opportunities and different needs of learning and of thinking strategically. But on the other hand, digital is also an educational tool, is a tool to train and to educate new generations, new students, but also our patients. The use of digital technology in medical education is of course growing at a fast rate, and with the pandemics we saw this worldwide in a broader dissemination, with virtual reality, artificial intelligence, increasing use of remote learning. And we need to know what is the impact of these new ways of teaching and of training in the students' learning, but also the inclusivity and having the access of this by the different populations, and what is the role of the new methods alongside with the traditional methods, and how to blend them. Also, the advances in digital technology and big data are creating more accessible and interactive educational experiences, but we need to be sure that they are really more accessible and not increasing the gaps between the different people and different individuals. The relationship between technologies, educators, learners, practitioners is changing, and we think that this can improve the education, that can become more interdisciplinary and interconnected if we use this in an efficient and good way. The future digital health requires professionals and the patients here are also very, very important because they need also to be educated to use these new digital technologies. And with this, we can empower the patients, but also the students through these digital means, with equity, diversity, and inclusion, the different perspectives on this digital health education. And we need to know what are the disadvantages and the advantages of using the different tools in digital health. And for as the last considerations, the ethical and legal dilemmas that we need to think about, because these are unique and specific of digital health, and sometimes they are not addressed yet because this field is new, and there are some topics that we need to discuss. Of course, the confidentiality, but also the safety of these new tools. There are increasing, for instance, the increasing number of patients that are sending photos for the physicians or different types of information, but from the end of the clinicians, how to keep safe all this information, how to storage these, for instance, images from patients. At the same time, the equity of using technology across different patients groups, because if we turn everything to digital, of course, there are people that will not access to this, and Micaela mentioned the importance of the aging people, and now for some of the elderly people, these are not the present, and maybe not for the future of them. So we need to have the traditional care to add to this technology care. There are also the patients that are untrained, and they do not know how to use the information that they can search and find, but sometimes they can send, for instance, a photo of a lesion, but the other one, skin lesion, is more important. So this could lead to problems in the diagnosis of some problems, and we need to focus on teach patients on that and think on the data protection. And these were some considerations, but of course, in the discussion, we will have the time to deep on this. Thank you, Jefferson.
Thank you very much, Helena, for your thoughtful presentation, and also by keeping, as Micaela, the time of the presentations. I found very interesting your approach on the strategic thinking and also the ethics in digital health. I think this is a very important aspect, not only for professionals, but also for medical and other health profession students. This is something that all this communication that we have, all this behavior of taking pictures of everything and sharing in social media is something that we must pay attention and also give guidance for the students and for the professionals on what is ethical and what is not ethical. Well, let me present to you myself. I did my presentation in the beginning, but I'm Jefferson Fernandes. I'm a neurologist, and I'm director of education program of the International Society of Telemedicine and Digital Health and e-health, sorry. And I also have other activities. I was a professor of neurology for 20 years in the medical school of the Pontifical Catholic University. Then I moved to work also in during that time, and also now in the management of health. I was director of 2 different hostels in Brazil, one in Porto Alegre, my hometown, and in São Paulo, where I live now for the last 12 years, and involved in this field of telemedicine since 2005, so quite long ago. And now also working different areas of digital health. And I'm also the regional editor for the journal Telehealth and Medicine Today from the USA and other activities. And I hope that my presentation could be a kind of continuation of what Micaela and Helena had presented. Can you see it? Is it okay? Yeah, okay, thank you very much. So I'm going to talk about digital health education, some aspects and some initiatives that are present. And the questions that we are tackling in this webinar is how can current doctors keep track with digital advancements in healthcare? And how can future doctors be prepared for the digital healthcare revolution? Micaela and Helena presented several aspects of what is going on and what will be happening in the near future. So the answer is in the title of our webinar, Digital Health Education and Training for Professionals, for Students. And we must think that now we are becoming, as in this book of Robert Wachter, published several years ago, we're becoming also a digital doctor. So we need to develop skill and competences for digital healthcare, and also lifelong learning in digital healthcare for current doctors and health professionals, and implement digital healthcare as a main topic in curricula for medical and health students. And of course, the training education on digital healthcare should be spread in all countries. And we see now that not only in-person training, but also, as he said here, from the bedside to website. So now we can have the opportunity, the students can have the opportunity to learn using digital tools. And this was a program that I coordinated in 2008. So 14 years ago, I was the coordinator of one discipline in the medical course of the medical school of the Pontifical Catholic University. And then I introduced the content of in the curricula of telemedicine. And we developed, one of the programs that we developed was this tele-education or tele-surgical education for the medical students. So you can see here in the bottom left, the students were in a classroom. This was one of our inaugural classes. And then the surgical resident, or the assistant surgeon would present the case for the students. And then we could follow the surgery with a camera, not just looking in the operating field, and being able to discuss with the surgeon what was going on in this surgery. This was a very attractive strategy for students to learn. And towards the middle of the program, we were able to join medical students from Poland, from Lithuania, and from Estonia. And we have published this experience in the medical informatics in United and Health Europe proceedings in 2009. So this is one aspect that I would call attention, that we need more digital health education within the curricula of medical students. And this survey done by the American Medical Association found that the physician adoption of technology, and the case digital health, was facilitated by the availability of resources and training. Of course, other aspects such as easy access to accurate data, positive impact on quality of care, and evidence-based for the tech solution. And saying some examples of what is needed to know terminology, what we're talking about. And we can identify that the current terminology of digital health is inconsistent. There is broad agreement over what's meant by the different terms. Digital health, for instance, are we talking about the care of people? Are we talking about the development of solutions of technologies? Telehealth and telemedicine, are they the same? Or telemedicine is just for physicians? And virtual care, what is that? So we can see on the right a proposed taxonomy for digital health. And this is something that is a discussion that is going on. But we should teach these kind of situations for this kind of topics for the professional students. And a common shared language can allow progress across clinical, research, regulatory, reimbursement, and other issues. So we also have all these several applications of telemedicine, telehealth, such as the promotion of healthcare, primary and secondary prevention, diagnosis, therapeutic interventions, monitoring of patients, management of chronic patients, that preferably should be done in a continued in a continuous way. And now we know that we are mainly working in silos, but it is something that we should also teach to professionals what is this, how they could be and should be developed. And of course, in education, research, and health management. And also understand technologies. Now we have several technologies, such as devices that we can use for the support of the examination of the patient at a distance. And also wearables where you can get signs, information of vital signs of patients for us to follow their care. And also we have this aspect of artificial intelligence and machine learning. And sometimes we have to think if it's could say instead of artificial intelligence, artificial narrow intelligence, because I think there is much hype on what artificial intelligence can do. And you know, machine learning is the base of it. And there are mathematical calculations that we call algorithms. And these work depending on what is the input that we give to these computers. So it's important to understand what is it for, what is hype, what is not, and to understand that this works only as, in my view, as an augmented intelligence. The physician or the health professional should give the last word, the last diagnosis, the last word on diagnosis, on therapeutics. So AI is helping, is augmenting the work of the physicians. And you could write augmented doctor intelligence. But as we have many concepts, many words, many terminologies, perhaps you should keep not developing new names. And also, it's important for the professionals and students to know that when you have new technologies in healthcare, we need to reevaluate how we establish the best relationship with patients. And a great doctor-patient relationship through virtual care can be established as long as it's done considering how, when, under what circumstances, and with who it is used. So it's something that we should learn. And I like to stress that, in my view, telemedicine, telehealth, teleconsultation, virtual consultation, they are not tools. Tools is the hardware, is the software. Telehealth and telemedicine are methods of take care of patients. And as such, they should be trained on. We should learn about it. It should be taught. You can see here in this nice picture, a doctor well-dressed in a very clean ambient, looking on the eyes of the patient, establishing this relationship at a distance, a remote care of the patient. So we also need to understand how to communicate with patients that bring trust, that bring empathy, and the patient feel confident that the care that he or she is taking is the same as it is in the in-person one. And this brings to the very important aspect of humanized care. So this is something that we say, of course, we have high tech, but we should also have high touch. And training in digital health, telemedicine, telehealth, again, is something that we should spread, we should disseminate, we should promote. And coming to initiatives, I'd like here to stress a bit our education program of the International Society. You have the address here on the right low side of this screen. If you are not a member of our society, please join us. We have a lot of education material that is there, such as this webinar and others, the courses that we develop with free access, and students don't have to pay to be a member, and you can contact several other students from all over the world. We are now developing, and we had started last week, a prize for projects where students are involved. So we have the first session, we're going to have 2 other sessions where the students previously selected are presenting their projects, and the jury is evaluating and in the end, they're gonna receive a prize in cash to go to meetings, to go to conferences, to go to congresses, making good use of this, or to have fun as well, no problem. And our education program has some strategic goals. We coordinate and manage the overlapping education activities of the society's organs, such as the working groups. We have several working groups in different topics, such as accreditation, cardiology, urology, nursing. There is also the CONIDI, the Consortium of Education Institutions in Digital Health, that we trying to join activities and also to bring other institutions. Up to now, we have 7 university institutions or faculty schools that join, and we help to promote the courses that they are doing. And I said the student memberships, which is coordinated by my colleague, Dr. Simone Fara. And the other strategic goals that we have is to foster key education with education projects in partnership with institutions, organizations, education projects that we self-developed, flash course series, webinars as such, this one, and also the endorsement of education programs developed by different organizations, institutions. And after evaluating, we can approve or not and give this endorsement seal of education with the brand of the International Society. And Micaela touched in this course, which I invite you to consider participating. It's a course on key health knowledge. It's an immersion course, key knowledge in digital health. It is promoted by the AHED, the Advanced Health Education of the Nova Medical School of the Universidade Nova de Lisboa. Micaela and I were the coordinators. It's going to be held on the 24th and 25th of October this year in Lisbon. And among the topics that we'll approach are healthcare challenges, health trends and dimensions of digital health, telemedicine, telehealth, value proposition of digital health, the design of a hybrid health journey, because this is the new normal, if I may say, in-person and virtual care complementing each other for a better care of the patient. You can reach more information on www.ahed.pt. And we are going also to have on the 26th, it's an optional activity, technical visits to different organizations in Portugal to bring practical information for you, what's going on, what's happening in the real world, to illustrate and to bring more information on what we have approached in the course. And of course, it's a wonderful opportunity for those that are not in Portugal, and if they have not yet visited, or if you have already visited Portugal and is willing to come back, to come this wonderful country, to this beautiful city of Lisbon, to the fantastic people, food, wines, and sweets of Portugal. Delicious sweets such as Pastel de Belém e Travesseiros de Sintra, which I'm looking forward to eat again next time I'm going to Portugal. And finally, I would like just to announce the Global Summit Telemedicine Digital Health, which is a meeting held in Brazil this year. It's the 4th edition. It's going to be in-person one. We started in 2019 in a person activity. Then in 2020 and 2021, it was virtual, but hopefully we are going to do it in person. It's everything being organized for that. It's going to be from the 4th to the 6th of October 22. And we are going to have international speakers that will present conferences and panels, and also national speakers in the same approach. We're going to have also exhibition hall and opportunities of networking. And this is something also very important in these present activities, should be our digital health course, should be the Global Summit, is the possibility of networking. So the Global Summit, which I'm the president, involves three aspects, which is education, networking, and business. So thank you very much for attention. And please, if you have questions, you can insert them in the Q&A button, and don't be afraid to ask anything. If you're a student, it's a good time to share your doubts, your anxieties on digital health. But let me start doing the first question to Micaela, and I was very, very well impressed by your presentation, Micaela. And I would like to know your view on of the present attitudes of doctors and other health professionals toward digital health. What do you think is the common ground? What do you think is the common behavior of doctors regarding adoption and their views of digital health at the moment?
Well, I think there is a time before pandemic, and then there is a time after pandemic. What this is concerned, because of course telehealth, telemedicine, digital health is here for much longer time, but in times of awareness and even more important, trying it out. So the pandemic has really made difference. So many clinicians, healthcare professionals, doctors, nurses, therapists, and so on, they tried it out during the pandemic. They had to try it out. So even those that were maybe more resistant, less convinced, and yes, so I think this was a very important moment. But when telemedicine or digital health is used as only as a substitute for something that is not available at the time because of a virus, and it's not really changing the way you provide healthcare for the better, of course, then the tendency is there is a big tendency to go back to former ways of providing healthcare, and this means in this specific case to privilege on-site consultations again. Just let me there is really an interest there, a really interesting phenomenon that I have had the opportunity to witness at COOF, for instance, where during the pandemic we had huge adoption of teleconsultations, for instance, and then now these teleconsultations, the numbers have gone down again, but of course still much higher than before the pandemic. And what is really interesting is that there are clinicians from the same specialty that probably have the same profile of patients, and there are some who still have a lot of teleconsultations, and others, they almost abandon teleconsultations. So it is not, and when then we look what happened, why are they doing it differently? Usually what we find is that those that still do very much teleconsultations, they reorganize the way they provide care. For instance, those people, they began to provide care, for instance, from home. So you can do that at COOF if provided you there are rules established in order to be professional, as you showed it in your presentation. But so there was a value proposition, a very clear value proposition also for the healthcare provider. So I think this is really a crucial point. So digital health is has to bring value to all the stakeholders. It has to bring value to the patient. It has to bring value to the healthcare professional as well, in order to be really adopted.
Right. Thank you. Thank you very much, Micaela. Just a comment. Now, it's interesting to see our experience here in Brazil. I live in São Paulo, as I mentioned. And previously to the pandemic, we were not allowed to do teleconsultation, physician direct to patient. It's something that I was very upset about that, because it was just to see what's going on in other countries and other parts of the world and the benefits. We are not providing these benefits for our population. So when the Federal Medical Council decided to publish one resolution in 2019, and it was put into discussion, that there was a kind of outrageous reaction for certain components, certain groups of physicians that we're going to lose the relationship with patients, medical patient relationship. We're going to lose patients. We're going to lose our jobs. So there was all these fears of that, and the resistance was very high. As I mentioned, I was working on telemedicine since 2005, so I was one of the guys that was trying to push this to happen, because our resolution from the Medical Council was in 2002, not allowing teleconsultation. But anyway, when the pandemic came, there was no other way of taking care of patients that need to stay at home without telemedicine. So there was an ordinance from the Ministry of Health allowing teleconsultation, followed in next month for a new law that also allowed it during the pandemic. And physicians had to start doing that. And this experience, understanding better what is telemedicine, what is teleconsultation, what is telehealth, made a huge change. There was an exponential increase of teleconsultations in Brazil. We are a population of 211 million people, and the increase of teleconsultation was and is still amazing, as thousands of teleconsultations daily for different providers. And finally, a few weeks ago, there was a new resolution, and making it for definite times definitively the work on teleconsultation, and a new law is coming out probably next month. And this changed the behavior because they have to understand, to understand, do not be afraid, because if people are ignorant in the broad sense of the word, they're going to be afraid of what's to come. So experience and practice, and of course, showing how to do it, it's important. So I'm going to do another question just now for Helena. I think it's going to be our last question to talk time. When we start to talk about it and discuss, it's exciting, and then the time goes more quick than it's usual. And I think it's a problem with time. It's not a problem with us. Sorry, Helena. I work in a group that's called the Global Healthcare Alliance. It's a program, and we have developing a group called Workforce Skills. And yesterday we were just having a morning discussion, and it's a group from several countries in the world, from Brazil to Australia, Europe, and so on. And it's one of the common views is that we are not being the organizations are not providing the education that is needed, enough education and training that is needed. And from your views, talking with students, getting their views, what are the expectations for their training, for their professional as regard to digital health in the Nova Medical School, or in the schools of the Universidade Nova de Lisboa?
Thank you, Jefferson. I think our structures and institutions are slowly changing, but the change is slower than in the society. So our students use every day the WhatsApp and the computers, everything. In fact, our exams are done in platforms, and we don't use paper for the exams, for the written evaluations, of course, not the practical one with patients. But when we are talking about, for instance, exams, it's easier to use a platform and to choose, for instance, the different answers electronically, because it's easier to have the correction of the exam and the classifications, because the answers are exported. And if they this year, last week, we had a problem with the platform, and we have 300 students per year, and in an exam, a medicine exam with 300 exams, there was a problem with the platform, and we needed to turn to paper, and it was a nightmare because the students are not used to do that. They have different copies for the exams, lots of paper, how to correct this on paper. So there are parts of the schools that are already adapted, of course, for the interactions in also in different platforms with contents, with papers, with manuscripts, and different materials that support the teaching. But the subjects, the topics that we need to teach, they are not yet in the curriculum. So I think the change in the curriculum is slower than the expectations of the students. The supporting things are already developed, the remote lessons with the pandemics, and there are lots of different methodologies that are already digital, but the contents teaching digital health is delayed.
Right. Thank you, Helena. And this is something that happens in several countries. And for instance, in Brazil, we have more than 350 medical schools, too much in my view, and only 15 of them have in their curricula contents on digital health, on telemedicine, and telehealth. I went just to there is one question here, and it's done by Bulanli Meful, and that asks, is it possible to be a medical specialist and a digital health expert?
This is Micaela. This is Micaela.
Okay, Micaela, it's up to you now to answer this question.
Well, I would very much like to believe that I'm a medical specialist and a digital health expert. So I hope I'm true, and if this is so, then it is possible. Well, but now a little bit more serious about this question. Of course, I think it is very, very important that healthcare professionals assume leadership roles in this digital transformation, because this is about healthcare. It's not about technology, and therefore it is really very important, because what we are doing is redesigning, reinventing how healthcare is provided, and therefore you need a deep understanding of what healthcare is. What is it to treat the patient? What is the relationship between a caregiver and somebody who receives care? And this is why, yes, of course, I think this is the best combination.
Yes, okay, thank you very much, Micaela. Well, unfortunately, we have to stop our webinar. I think we have these wonderful presentations from Micaela, from Helena. I hope that attendees of this webinar have enjoyed it. And I hope that you follow us in the International Society for Telemedicine Health programs. Please join us as members as well. And Nice for you to stay here. And Micaela, Helena, thank you very much for your participation. We had a wonderful time. See you next time.
Thank you so
Bye-bye.
much. Bye. Thank you.